Hello everyone, welcome to Pediatrics by Dr. Anand. Is my voice audible to everyone? Please put a message in the comment section. Thank you. Hello everyone. Actually, this live session, it takes around 2 minutes to buffer the whole video. That's why it takes around little time to come to live. Is my voice coming to everyone? Yes or no? Please put a message in the comment section. Thank you. A beautiful evening to everyone. Such a beautiful day. We have beautiful people who have joined the classes. Good evening, everyone. My name is Dr. Anand. Is my voice audible to everyone? Please put a message in the comment section. Thank you. Okay, so in this segment, we're going to talk about the beautiful cardiology. Cardiology classes are coming to an end now. I hope my voice is audible to everyone. Today, we are in white t-shirt, white, looking glowing white. Is my voice audible? Is my face audible? This is my front profile, this is my right profile, this is my left profile. Am I visible? Yes or no? Yes. So beautiful. Yes, exactly. Great. My name is Dr. Anand. I've done my MBBS from Rajiv Gandhi University Health Sciences, Bangalore, and I've done my MD from Uttar Pradesh, TMU College. I'm assistant professor in a medical college with some amazing teaching experience. Also, at the same time, we teach to the beautiful UG, PG, and DM and MRCPCH students. We have separate batches. You all are most welcome in that. Today's topic of choice is cardiology and some new crazy session. Crazy session. Okay, thank you so much. Let's start this beautiful class, bro. Before starting any amazing segment, we always have a motivating quote. And today's $1,000,000 motivating quote is, what is the quote today? Today's quote is, change is never painful. Change is never painful. Only the resistance to change is painful. A very thoughtful choice. Think about it, bro. So yes, exactly. So change is never painful. Only the resistance to the change is painful. Okay. So, we all get scared in the changes of life. We always say, like we do not want to step out of our comfort zone. We do not want to step out of our comfort zone. Are you understanding? Whatever happening in my life is fine. Same college, same teacher, same batch. It's okay. I don't want to try anything new. Why? Because we get scared. Change. We always say you must go out of your comfort zone. If you go out of your comfort zone, you will face challenges. You will face ups and downs, and it will be good for you. It'll make your picture broader. It'll make your vision amazing. Okay, so change is never painful. Only the resistance to change is painful. Okay, so moral of the story is, you are a perfect soul. Moral of the story is, I'm ready for any change. Moral of the story is, try me. वो कहते हैं ना, there's a saying, right? Like, don't say why me, say try me. Okay, say to yourself, why me? Don't say that. Say try me, and I will be there, and I'm ready for any hardships. I'm ready for any struggle, because struggle also will teach me, hardship also will teach me, everything will teach me. So don't say, that why me. Say try me. I'm amazing. Do you agree? Yes or no? Dr. Shubham कुछ लिख रहा है. Shubham is like, white is like a dream, a heaven, same seems when you wear it, Sarji. Sir, your love is more than enough. Okay, I hope the white t-shirt is okay. Is the white t-shirt looking nice? We have done various t-shirts, white, black, and blue, and this is the one second. Yeah, $1,000,000 biceps. Today was my shoulder exercise. Biceps, triceps is tomorrow. So you tell me, guys, how are you doing? What did you guys do in the evening? This class is gonna be a very crazy class, because we'll be covering some new stuff. I'll be showing you some amazing called syndromes, where you might not have even heard the name, but today we will unreveal those amazing syndromes. Okay. सब लोग हैं कैसे, ये बताओ भाई, क्या चल रहा है लाइफ में? How's everyone? I feel so happy when we meet all of us together. This 8:30 p.m. time is like it's like a family time. Like, I know Shubhangi, Shubham, Suman, Manish, Faizan, Raza, Shubham, all people are like amazingly come, and we chat and this and that, and we chill out and study nicely. Like, that's the best part. We get to talk, we get to chat, and we get to learn some amazing stuff. Today's topic of choice. Oh, I love this transition. Can we have it again? This is nice, no? Shubhangi, kaisa hai transition? See. Ooh. I'm so crazy. बिना बात के छोटी छोटी चीजों में खुश रहना, it's really nice. Yes. So question number 171. Today is a cardiology. The cardiology classes are coming to an end. Thank you so much for a 5-star amazing sessions of cardiology. Let's start studying. Lutem-Becker syndrome. Lutem-Becker's syndrome comprises of what? The options are VSD with aortic stenosis, ruptured sinus of Valsalva aneurysm, ASD with MS, or complete common AV canal defect. Can anyone answer in the comments section, please? Hanji, batao jaldi. So what is this Lutem-Becker syndrome? Today also I got nice time, 2 hours I got in the morning in my hospital. I opened Nelson, every book I opened, studying some crazy stuff, and I was so happy. I was like, wow, today I have something new to share to the rest of the planet. So it's so beautiful to share knowledge. Hanji, can you please, can you please tell me in the comment section, what do you think, guys? Osama and Sheikh, if this question comes in exam, actually this was a 2018 question. This was a 2018 question actually. Lutem-Becker syndrome comprises of what? So for, yes, exactly. So for the beautiful students, please remember that Lutem-Becker syndrome comprises of ASD with mitral stenosis. Please today take deep breaths, update in your notes that Lutem-Becker's syndrome comprises of, there's an atrial septal defect with mitral stenosis. Atrial septal defect with mitral stenosis. Please update in your notes. If the patient has an ASD with MS, atrial septal defect with mitral stenosis, that patient can land up into one syndrome known as Lutem-Becker's syndrome. Now it is a congenital ASD which is complicated by a MS. Okay, listen very carefully. It's a very beautiful, cardio is so easy, bro. It's like heaven. Okay, so the patient has ASD with the patient has mitral stenosis. Can we appreciate this point, my dear friend? The patient has a atrial septal defect with the mitral stenosis. If this becomes a 3 marks question, okay, if the examiner is very angry with his daily routine, or he fought with his wife, then Baba, this will be your question 3 marks. He'll be like Lutem-Becker syndrome. You know, my HOD always used to say, whenever I make question paper for final year MBBS students in my college, my HOD says, Anand, at least two question you should make. It should be always out of the syllabus. At least 1 or 2 questions must be out of the syllabus. Everything should not be just exactly in the syllabus. So yes, Lutem-Becker syndrome now is a topic of choice. So number 1, what did I understand? A congenital atrial septal defect which is complicated by a mitral stenosis. So it's ASD with the MS. That is the first important point which my brain should understand this point. Or kya hota hai, sir? What else is there? Exactly. So yeah, can I appreciate this point? See, every single line has a meaning. Okay, please absorb this beautiful spiritual energy and understand the topic. Can I say, hello, can I say if the patient has mitral stenosis, then the left to right shunt will be more? Is this line true or is this line false? Can anyone answer in the comment section, please? Quick answers, okay? Good vibes. I want good vibes, okay? Good vibes. Yes, exactly. Today also, whenever I go for shopping, I always say, from these clothes, I'm getting good vibes, okay? I'm getting good vibes. So let's just take it. So can you please tell me if the patient has a mitral stenosis with a congenital ASD, the left to right shunt will be more or the left to right shunt will be less? Obviously, if there is a mitral stenosis, then naturally, my dear, the left to right shunt will be very more. Okay, that is the first point. Second important point I must appreciate. Can I say, yeah, obviously, it's such a beautiful point. So yes, we're such a beautiful point. Can we please appreciate this point that if the patient has a mitral stenosis and also the patient has a atrial septal defect, which is a left to right shunt, of course, my dear, can I say the patient can have a right atrial hypertrophy? Can I say the patient can have a right ventricular hypertrophy? And can I say that patient will have a pulmonary artery dilatation, right atrial hypertrophy, right ventricular hypertrophy, and pulmonary dilatation? So now if this becomes the 3 marks question of Lutem-Becker syndrome, very beautifully you can incorporate some amazing points. Number 1, it is a congenital ASD with mitral stenosis. As there is mitral stenosis, there is more left to right shunt, and the patient will have right atrial hypertrophy, right ventricular hypertrophy, and pulmonary artery dilatation. And yeah, okay, I hope very beautifully everyone has got this point. Okay, beautiful, amazing. Yeah, now this is a very smart thoughtful question I have here. Can the patient have features of infective endocarditis? Can you please think in your tiny 250 grams brains and tell me in the comment section, my dear amazing friends, that can a patient of Lutem-Becker syndrome can have features of infective endocarditis, yes or no? And this infective endocarditis, is it different from if I'm reading a topic of only atrial septal defect? If I'm reading I'm reading two topics. Imagine I'm reading two topics. One topic is only isolated atrial septal defect, and one topic is atrial septal defect with mitral stenosis, nothing but a Lutem-Becker syndrome. So can we please appreciate some point? Can you just please think and tell me, bhai, in which of the patient will have infective endocarditis symptoms? Is it more common in ASD, or it is more common with ASD with mitral stenosis? Who will tell me? You have 5 seconds to answer this question. Anyone? Yes, tell me, tell me, tell me, tell me, tell me. Yes. तुम्हें हो ना हो मुझको तो इतना यकीन है, मुझे प्यार तुमसे नहीं है, नहीं है. So yes, bro. So why such a stressful point? So the beautiful answer for this question is, sir, if you're talking about atrial septal defect, it is very less likely. It is very less likely for a patient of ASD to go into infective endocarditis. Are you understanding? For saying infective endocarditis, see, are you understanding? Anything which is far from the pulmonary artery will have, will have the less, likely features. So if I talk about VSD patient, yes, VSD patient can definitely have features of infective endocarditis. If I talk about patent ductus arteriosus, of course, patent ductus arteriosus patient can have infection or infective endocarditis. Are you understanding? Anything which is closer to the pulmonary artery can lead to infection, right? So PDA can lead to infective endocarditis. A VSD patient can land up into infective endocarditis, but atrial septal defect, it is very less likely, or I would say it is the last thought of the choice if I think of infection or infective endocarditis. This is about isolated atrial septal defect. But please remember, if someone is having atrial septal defect with mitral stenosis, so naturally the left to right shunt will be very, very high. The left to right shunt will be very, very high, and of course the chances of infective endocarditis is much more in a case of ASD with MS as compared to isolated atrial septal defect. Has everyone understood this much? Yes or no? Please let me know in the comment section. ओके समझ में आया डियर? नहीं आया? ओके शुभम, शुभम कह रहे नया गाना. शुभांगी कह रही ये गाना आज पहली बार सुना. पहली बार? अच्छा, मैंने नहीं गाया ये वाला गाना. अच्छा, ओके, ये गाना अच्छा लगा. वैसे मेरा मूड खुश था ना आज, अच्छा शोल्डर मैंने किया, तो आई थिंक दैट्स व्हाई न्यू सॉन्ग मे बी बाय मिस्टेक आ गया. Has everyone understood this much? Please let me know. Please put a like button, or at least just tell me, did you get it? That the patient of ASD with MS will have a very high chances of infective endocarditis because it is total mitral stenosis, and all the blood is like too much of blood now jumping from the left side to the right side. So then naturally the patient can have a infective endocarditis features. I hope everyone has understood. And nursing, we have nursing shorts ID who says our most common congenital heart disease. Yes, dear, I hope you know that the most common congenital heart disease in full cardiology is a VSD. The most common congenital heart disease in cardiovascular system is a ventricular septal defect, VSD, VSD. Okay, perfect. Next question, please. Yeah, so this part is over. I will go to the next question. Please. Okay. Now, this is a NEET super specialty question. Many of us batchmates, we are here, which are preparing for NEET SS, NEET super specialty. So yes, can you please tell me this answer? The type of atrial septal defect, as we just now read about it, Lutem-Becker syndrome is comprised of MS with ASD. Which ASD is very, very common in this case? Is this ostium primum type of atrial septal defect or ostium secundum? Can you please tell me? Anyone, please tell me. Hanji. We have beautiful students. We have Aditya, we have Shubhangi, we have nursing blocks. Okay, we have Ahana Thakur. Okay, we have Faizan Raza. Okay, very good, very good. Okay, can you please tell me in the comment section, please? Exactly. Osama, bro, so proud of you. The most common type of atrial septal defect in a case of Lutem-Becker syndrome is ostium secundum type of ASD. And if I talk about atrial septal defect topic per se, which is the most commonest type of ASD? Is this the ostium primum ASD or ostium secundum ASD? Everyone knows about it. The most commonest type of पहले तो मैं सांस ले लूँ. I speak so fast that I forget to take breath also. The most commonest type of atrial septal defect is ostium secundum type of ASD. Uh, the most common congenital heart disease in Down syndrome. The most common congenital heart disease in Down syndrome is ostium primum type of ASD. If I talk about atrial septal defect topic per se, the most commonest type of ASD is ostium secundum type of ASD. The type of ASD in Leutenbecker syndrome is also ostium secundum type of ASD. I hope everyone has crystal clear has understood. समझ में आ नहीं आया. Okay, I will give you one 5-star. I will give you one 5-star chocolate if you can please tell me where else do we see ostium secundum type of ASD. Can you tell me anything in the pediatrics where the most common congenital heart in dash is ostium secundum type of ASD? One is Leutenbecker syndrome. Other one, please. Quick answers, please. Yes. Okay. हाँ ना ठाकुर. हाँ जी. Okay. Yes, Dr. Amrit. I'm so proud of you, Amrit. I'm so proud of you. Amrit is answering really good. Amrit is doing MD Pediatrics and is one of our very amazing, very good students. The most common congenital heart disease in Holt ORM syndrome is nothing but ostium secundum type of ASD. We must link and study, my friends. We must link and study. Okay, घोड़े की तरह है, not like a horse. We have to study the topic. Like if you're talking about Leutenbecker, only Leutenbecker. No, you have to wide your vision. You have to wide your vision and look at the topic as 360-degree angle. Next question, please. Okay, a new transition. Okay, it's like a chapter, it's like a novel. Okay, that's nice. So I'm reading this latest novel. Is anyone reading some amazing novel? वो novel का नाम ही भूल गया. अभी मुझे एक मेरा junior है अंश, उसने बताया था. तो नाम भी इतना tough होता है ना novel का. Varsity, some strange name is there. Tomorrow I'll tell you. It's a very nice murder mystery. It's a very nice murder mystery. Are you guys reading any novel? Can you please answer in the comment section, guys? Reading novel is a beautiful habit. I recommend everyone to read some amazing novels. So which kind of novels do you like? Do you like love stories? Do you like crime? Do you like kind of a fantasy, criminal movies? Which kind of novel do you like? Please, can you answer in the comment section? Yes or yes. I personally like crime, murder, mystery, psychopath, killer stories because that is like very nice. Love, I stay away from love because my love history has not that great, so I stay away from love. कहते हैं ना, देखो मगर प्यार से, देखो मगर दूर से. It's like this for me. I like crime novel mysteries. I recently finished a novel of a silent patient. I recommend. It's a good read. It's a good read. Silent Patient. I just now started with one amazing novel. I forgot the name also. The best part is that only some varsity, some strange name is there. Tomorrow I'll tell you. But it's really good. It's really good. It's simple English. It's a crime mystery with little love tinge. So it's beautiful. Hanji, what all do you like? Aishwarya, suspense. Okay, nice. Okay, Karan like novels on self growth. Very good, Karan. Proud of you. Radhika, mystery, psychological, same. Shubhangi likes friction. Okay, friction, fiction. Okay, friction. I thought friction. Okay, Osama. Okay, Doctor Shubham, poetry. Okay, great. Beautiful people, beautiful things. Okay, topic of the choice. Can you please tell me, bro, what is differential cyanosis and what is reverse differential cyanosis? Can you please answer in the comment section? One of the very common question, guys, and many of us do mistake in this. Can you please tell me, bro, that what is differential cyanosis, what is reverse differential cyanosis? In my hospital also, many final year MBBS students have always have doubt in this one. So anyone, any random guesses, bro? What do you think? Yes. Okay, very good. Yes, already Dr. Osama Sheikh, one of my favorite junior, has already told the answer. So differential cyanosis. अब देखो यहाँ दिमाग लगाना पड़ेगा. Now guys, listen. You have to use brains. Now it's time to use brains because I can tell you the example of differential and reverse differential like this, but you need to literally think about it. Okay, may have a copy and a pen and just think. Just try to analyze. Once I'll tell you the answer. Okay. So what is okay? First, deep breath. Hmm. Differential cyanosis. What is differential cyanosis? When the feet are more blue, When the feet are more blue than the hand, when the lower limbs, when the different, one second, कहाँ चला गया ये, तो हाथ इधर उधर लग जाते हैं मेरे. Okay, when the lower limbs are more cyanosed than the upper limbs. Okay, differential, okay, differential, L, lower limb L. In a case of differential cyanosis, lower limb will be more blue than the upper limb. Can you please tell me in the example section any one example of differential cyanosis? And for this, see, cardiology is like maths, bro. Cardiology is like maths, okay? You can't cram the whole stuff. 2 plus 2 has to be 4. It can't be 5. It's like a mathematical calculation. You can't cram cardiology. You must understand the concept. Yeah. Example, please. Example. Yes, exactly. Oh, Aditya Singh is saying, with your blessings, I qualified step 1. Ooh, okay. That's amazing, bro. Amazing. So happy to hear this beautiful, what you called, yeah, 1 second. I'm gonna pin. How to pin this? Go to channel, replace the pinned message. Okay, yes, exactly. So I'm gonna pin this message, bro. Very beautifully, you have told us. You have qualified step 1. That's a very big thing. The example of differential cyanosis is nothing but PDA with a reversal of shunt. Listen very carefully. Now, please, it's time to use your brains. PDA with a reversal of shunt. In that case, please write quickly. Open your mind, open your brains. I'm saying PDA with a reversal of shunt. You will have lower limb will be more blue than the upper limb. How? Why? Can you please tell me in the comment section, please? Why? Listen very carefully. Okay. PDA with a reversal of shunt. Let me just make a picture for you. Okay, 1 second. Okay, PDA. Okay, I don't know how to explain you. Okay, can you please tell me why PDA with a reversal of shunt can have problem? Okay, I'll tell you. I know the answer. Okay, let me make the diagram first. 4-chamber heart, cute heart. This is our patent ductus arteriosus, right? I hope we know this one. PDA. PDA is a left to right shunt. We know that. I am saying PDA with a reversal of shunt. PDA with a reversal of shunt. Reversal of shunt as in the PDA was a left to right shunt. When there was left to right shunt, there is increased pulmonary blood flow leading to pulmonary atresia or pulmonary stenosis, and the shunt which was left to right became right to left. That only is known as reversal of shunt. No, that only is known as reversal of shunt, right? So yes, so when the reversal of shunt is there, means the blood is coming from this way going like this. I am saying that the lower limb will be more blue than the upper limbs. So the beautiful answer why for this question is, as everyone beautifully knows, the oxygenated blood. Listen very carefully. The oxygenated blood from the lungs enter the left atrium. This is pure oxygenated blood. In a normal circulation from the lungs through the pulmonary veins, the oxygenated blood enters the left atrium. From the left atrium, oxygenated blood enters the left ventricle. I hope this much we are able to understand, right? Yeah, okay, very good. Then what happens once it enters the aorta? Once the oxygenated blood enters the aorta, before the ductus connection, or I would say pre-ductal. Can I write this line? Pre-ductal. Something is there pre-ductal, okay? Listen carefully. The oxygenated blood enters the left atrium, left ventricle, aorta. Before touching the ductus, aorta give branches. Aorta give branches, okay? Before mixing, before this ductus problem, little proximal to the ductal, aorta gives branches. Which branch are we talking about, sir? Which branch are you telling, bro? This branch. Aorta, this is a beautiful aorta, and this is the ductus. This is the ductus. So I am saying before touching the mixing of the blood, aorta gives a branch right brachiocephalic trunk and also the left brachiocephalic trunk. Are you understanding? Are you beautifully understanding? The oxygenated blood, it came before touching to this mixing, before touching the ductus. Aorta, beautifully oxygenated blood is going to the right brachiocephalic trunk, is going to the left brachiocephalic trunk. Is this blood oxygenated or deoxygenated? Is this blood cyanotic or acyanotic? obviously this blood is acyanotic. Yes or no? Because it's a pure blood, no? When the mixing will takes place of the reversal of shunt, then it's all cyanotic, right? It's all cyanotic blood. But before the ductus connection, there is beautiful, pure, oxygenated blood, right? So this right brachiocephalic trunk and left brachiocephalic trunk will get the oxygenated blood. So means this right and left brachiocephalic trunk supplies my limbs, upper limb. Yes or no? So can I therefore say that my upper limbs are less cyanotic, and after mixing the blood goes to my lower limbs, so lower limbs are more cyanotic than the upper limbs. Lower limbs are more cyanotic, because are you understanding, and upper limbs are less cyanotic. Why less cyanotic? Because before the ductus mixing only aorta, which has a fresh blood, it supplies fresh blood to right brachiocephalic trunk and left brachiocephalic trunk, means our upper limbs are getting a very fresh oxygenated blood, and then the mixing is gonna takes place. It's a PDA with a reversal of shunt, and all mixing blood, cyanotic blood, goes to the lower limbs. So lower limbs are more cyanotic than the upper limbs. And what do you call this, bro? Do you call this differential cyanosis? So the example of differential cyanosis is nothing but PDA with a reversal of shunt. PDA with a reversal of shunt. Has everyone understood this much? Yes or yes? Yes, S. प्लीज लेट मी नो, प्लीज लेट मी नो. समझ में आया या दिमाग के ऊपर से गया? दिमाग के ऊपर से गया. यू शुड हैव 1 स्पून ऑफ हनी विद 5 आलमंड्स एंड 2 एप्रिकॉट्स. समझ में आ गया? इससे अच्छा मुझे पढ़ाना नहीं आता भाई, कुछ और कुछ बता दो, मैं और अच्छे से पढ़ा लूंगा. समझ में आ गया माय डियर? हैज एवरीवन, बिकॉज इट्स गेटिंग द कांसेप्ट इज रियली इंपॉर्टेंट ब्रो. आई डोंट वांट यू टू, like, we all are like one family, okay? So I don't want even a single student, who should not be left out, that I am a newcomer and I have no idea what are you saying, reversal of and this and that. I'm literally trying my best to tell you from the A to the Z so that you can get some connection. Has everyone understood? मतलब ये बहुत ही मोती की तरह, बिल्कुल मोती की तरह क्लियर होना चाहिए ये पॉइंट. It should be very crystal clear to you, all of you. Please everyone let me know, did you understand? No, yes, maybe, whatever. Okay, say something. Okay, समझ में आ गया? Okay, Nancy says, what made, beautiful question. Nancy says, what made PDA with the reversal of shunt? Who made the reversal of shunt? So Dr. Nancy, whenever a patent ductus arteriosus is there, dear, it is a left to right shunt. Normally, Dr. Nancy, this is a 4-chambered heart, my dear, and this one is our, this is the pulmonary artery, and this is the aorta, and this is the patent ductus arteriosus, which is normally a left to right shunt. It is a left to right shunt. Whenever there is a left to right shunt, Dr. Nancy, the blood to the pulmonary artery will increase naturally, right? So nothing but known as increased pulmonary blood flow. And as we have told in the previous classes, imagine on a road, when there is too much of traffic on a road, that road slowly starts going to damage. So whenever there is an increased pulmonary blood flow, because the blood is coming from superior vena cava to right atrium to right ventricle and pulmonary artery, and PDA also from the left side to the right side to the pulmonary artery. Whenever there is an increased pulmonary blood flow, pulmonary artery slowly goes into fatigue or damage or obstruction or stenosis. So that will lead to pulmonary stenosis. Once naturally pulmonary stenosis or pulmonary valve totally block, the shunt which was left to right became right to left. This is the answer for your question, that who made reversal of shunt. Okay, क्या हम आगे बढ़ सकते हैं लाइफ में? Can we move further? Yes or yes? Okay, let's move further. आगे बढ़ते हैं. Okay, this part is over. I've tried my best to explain this part. Okay, yeah. Okay, yeah, okay, it's done already. So these are the explanation which we have already discussed, so I'll not go in detail. Okay, reverse. Ooh, can we please talk about it? Now, one is reverse differential cyanosis. See, these are like Viva voci questions. Okay, these are like Viva questions. Okay, Viva questions. If you impress the examiner, differential cyanosis, what is that? Reverse differential, what is that? Why it is? Explain the mechanism and all that. It's very nice. The examiner will be really happy. And how will you remember this? Teach someone, teach to your friend. Okay, tonight please teach to any of your friend, bro, I'll tell you what is differential cyanosis, what is reverse differential cyanosis. किसी और को पढ़ा दो, किसी और को दिल से पढ़ा दोगे ना, तुम्हारा इतना क्लियर हो जाएगा, you will get a, you will, it will be imprinted in your brain like it's imprinted in mine. Okay, reverse differential cyanosis, what is this, bro? What is reverse differential cyanosis? Can anyone answer in the comment section, please? Ooh, yes, yes, yes. Upper limb in a reverse differential, reverse, no, reverse. Reverse matlab ulta. Reverse means opposite, right? In a reverse differential cyanosis, upper limb are more blue than the lower limbs. Now, see, listen very carefully, bro. Whenever we say cyanotic congenital heart or acyanotic, remember one thing, like I read it in the books also, saying something acyanotic, like that does not mean that it's like the baby is purely pink. No, the baby is not purely pink. It's just that that area or that body part is less blue, less cyanotic. That is like acyanotic. Are you understanding? Cyanotic baby means the baby is totally blue. If I say upper, I said no, that upper limb are more cyanosed than the lower limb. So I will not say lower limb are totally acyanotic. I can say they are less cyanotic. They are less cyanotic. This someone told me. This someone very wise told me. Acyanotic का मतलब ये नहीं है कि बिल्कुल बच्चा एकदम pink है. Acyanotic does not mean the baby is totally pink. It just means that the baby is less blue, less cyanotic than the proper cyanotic term. Okay. Hanji, example. Can we please tell me the examples? Hanji. Okay. Oh, Faizan Raza. I said teach to some friend. Faizan says if somebody does not have a friend, then no problem. I think it's really cool. Look into the mirror and just explain yourself only. That's the best. The beautiful example of reverse differential cyanosis, actually it's multiple, exactly multiple, and the answer is TGA with pulmonary hypertension. Can you please quickly write in your copy TGA with a pulmonary hypertension? And can you explain me? Can you explain me? Can you explain me? Can you explain me? Why in a case of TGA with pulmonary hypertension, upper limb will be more blue than the lower limbs? Today also in the morning it took me 20 minutes to literally think about it. Upper limb को blood वहां से आया, वो blood came like that, it went like that, oh like that. It was very crazy. But once I got the whole concept, हमसे बड़ा कोई नहीं. Then we are the king of our own life. Exactly. Okay, Grace says, Faizan, talk to your pet. So I was not knowing, Faizan, you have a pet. I think having a pet is a beautiful thing. And what about, I wanted to ask someone actually. I was wondering to have a fish, a small bowl of fish, guys. What do you think? Like I was reading an article, and they say that having a pair of fish in a small bowl is like a stress buster. It reduces depression and it reduces anxiety. So could you please read once about this? And Shubhangi Osama, you have my mobile number, right? And Shubham, एक बार पढ़ के मेरे को बताना. Just read once and let me know that having a fish in the bowl, like a pair of a fish, is this good or is this bad? Like I was just thinking that having a fish, why? Because fish, no, like you're giving a very small space, and like fish are like Piscean and I am a Piscean. You want a big space and open space. So keeping the fish in such a small space, like I feel bad. I feel like why to keep something in such a small space. But then someone else told me that a small fish requires small area. It's good for them. If you keep those fish in a pond, then other fish will kill them. So please, I want you guys to think about it and let me know, because I was thinking to have a cute pair of fishes in one bowl and I want to keep it bedside. Let me know, please. Thank you. Okay, yes, okay. So now TG with pulmonary hypertension, we need to talk. TG with pulmonary, listen, think, just good vibes, think, listen to me again, okay. TGA with pulmonary hypertension, upper limb are more cyanosed than the lower limb. Why? Just tell me why. I'll tell you. It's very easy. Very easy. TGA. हाँ जी आगे आ जाओ जरा. TGA. What is TGA? Transposition of great arteries. Transposition of great arteries means normally on the right side we have pulmonary artery, but this becomes the aorta, and left normally we have the aorta. This becomes the pulmonary artery. This is TGA. I am saying TGA with the pulmonary hypertension. TGA with the pulmonary hypertension. Pulmonary hypertension, as in I am trying to say that this pulmonary artery is blocked. Do you agree with this? Yes or no? Pulmonary atresia will happen, pulmonary stenosis will happen, and then pulmonary artery hypertension will happen, right? So just imagine, I am having TGA where the aorta coming from right and pulmonary artery coming from left, and also I'm having a pulmonary hypertension. Why it happened? Forget it. I am having a pulmonary artery hypertension and I am having a TGA. So this is the picture. So this picture I have given to you, and I'm saying that in this condition, upper limb will be more yellow, more blue, and lower limb will be less blue. You know, I know the answer. Do you know the answer? Yes or no? Please let me know. Okay, I know the answer. Okay, I'll tell you. And I'm so happy when I know the answer. It's like a complex instruction, complex thing being filtered out nicely in my brains, and I feel so good about it. Listen very carefully. I want my knowledge to go to you now. Okay, listen. TGA with the pulmonary hypertension. As you all know that the lungs, we have the lungs, the purified blood from the lungs goes through the pulmonary vein. You know that, right? The purified blood from the pulmonary vein, it enters the left atrium. This is normal, right? This is normal from the lungs. Normally, the purified blood from the pulmonary veins enter the left atrium, and then it enters the left ventricle, right? Now I am saying, what I am saying? I am saying there is a pulmonary artery hypertension, or kind of a thing. I'm saying the pulmonary artery is kind of blocked, right? And naturally now the blood has to go somewhere, right? The blood has to go somewhere. So either the blood will go through a VSD, or the blood can go through a patent ductus arteriosus. Imagine the blood is going through the patent ductus arteriosus, and now we know that the blood will normally, PDA is a left to right shunt because the left side of the heart has a higher pressure. So if I open the PDA, people will jump from left to right only, right? You know that, right? You know that. Yeah. So now the blood from the left atrium goes to the left ventricle, and then goes to the pulmonary artery, then ductus arteriosus, and then the descending aorta. You know that, right? Pulmonary, the PDA, the patent ductus arteriosus, is between the pulmonary artery and descending aorta, right? This blood which is moving, this blood from the left side to the right side which is moving, tell me, is this the oxygenated blood or is this the deoxygenated blood? So I think everyone knows about it. I said the blood came out from the lungs. It's purely oxygenated, right? Purely oxygenated. So it's very easy explanation that the purified blood from the lungs go to left atrium, left ventricle, pulmonary artery, descending ductus arteriosus, and descending aorta. And from descending aorta, the blood goes to my whole body. And you know that, right? Just now we spoke about it, that this brachiocephalic trunk, no, just now I showed you the picture, right brachiocephalic trunk, left brachiocephalic trunk, that is like before the ductus, right? Before the ductus connection. So naturally over here we have the deoxygenated blood entering the right atrium, and deoxygenated blood entering the right ventricle, and deoxy blood basically going to the upper limb. And here the oxygenated blood, as you can see, from the ductus arteriosus, from the left side is going to the right side. So from the ductus arteriosus to the descending aorta, and then supplying the whole body. So descending aorta and then to the whole body, descending aorta then to the whole body. So whole body, as in the lower limb, is getting a very good blood, oxygenated blood, right? As you can see it very well. And the upper limb are getting little bad blood or little deoxygenated blood. That is why the upper limb are more cyanosed than the lower limbs. That is why upper limb are more cyanosed than the lower limb. Has everyone understood? Shubhangi, Osama dear, have you understood this part? Because the left to right shunt which is there, no, the ductus arteriosus which is carrying the beautiful blood, oxygenated blood from the pulmonary artery, it is going to the aorta, but only descending aorta. And before this mixing, before only we have the right brachiocephalic trunk and the left brachiocephalic trunk. That area is not getting oxygenated blood. That area is getting only deoxygenated blood. Are you understanding? So that is why that area means upper limb wala area. So that area means upper limb area. So upper limb area will be cyanosed and lower limb area will not be cyanosed, because lower limb area is getting the blood from the PDA, which is a oxygenated blood. Has everyone understood this much? बड़ी जान निकलती है भैया, पढ़ाने में तो बड़ी हिम्मत चाहिए मुझे लगता है. So yeah, like when your teacher, when your when you when your teacher desperately want you to understand the concept, okay, that becomes like it needs guts. Like when I really want, I always say to myself that I want my whatever knowledge I have, I want to transmit, because this is the purpose of mankind. This is the purpose of mankind. If you think on a broader spectrum, our parents, they are giving us the knowledge, the wisdom, they are giving us the experience, they are sharing the experience with us, they want us to be a better person. And same goes like this. I have knowledge, I'm sharing to you, so that you can treat patients well, you can be a better person, and then you will have children, you will have friends, and you will share the knowledge. So that's how one generation share the knowledge to the next generation. Okay. Has everyone understood? Please put a like button to this video, yes or no. 45 minutes are over. Okay. Yeah, Shubhangi is saying that yeah. Shubhangi is saying read my comment. 1 second. Okay. Okay. Shubhangi, Shubhangi says, sir, see my comment. Okay, 1 second. No, sir, fish. Okay, so you don't like keeping the fish. Okay. Shubhangi, I got your comment. You said that keeping the fish is not a good idea. Let's put a poll. Guys. 1 second. Let's put a poll, please. Okay, 1 second. Yeah. So, fish. The topic is fish. Should we keep a bowl of fish with a pair? Only two fishes. Because one fish, it will be alone, right? So, should I keep a bowl of fish? Yes or no? Please put an answer in the comment section. Let's see how the poll goes. Okay, anyone? Tell me. पता नहीं शुभांगी, मेरा तो मन कर रहा था रखने का, पता नहीं मुझे ऐसे लग रहा था, पता नहीं, अब हम बात करेंगे इस बारे में फोन पे, ठीक है, मैसेज पे चैट करते हैं. Dr. Wafa Hussain says that you have a great intention, Dr. Anand. Thank you so much. So Manisha says yes, keep the fish. Okay. Shubhangi, you are very sensitive, like me only. Anji, anyone, should we have the fish? Yes or no? We have a bowl. Imagine we have only two fishes in my home, in my room. Yes or no? कितना गंदा चेहरा बनाया मैंने, बट कोई बात नहीं. Okay. Osama says A. Osama, A क्या है bro? A, yes or no, Osama? Ritu says yes. Orion says no. Faizan, no. Meta Zillo, yes. Karan, yes. Indian lovers says no, it will die if not handled well. So I'll be the one who will be handling. What do you think? Then can we have it or not? Shark will be fine for you. For me, shark for me. Okay, fine. ठीक है. Okay. अयो, Aditya says keep पिराना. Aditya, Aishwarya. Okay. Shubham, yes, care and should feed them properly, Sarji. हाँ bro, means you say no. Mariam, okay, no. Grace says yes. Shubhangi, no. Aditya says Pirana will be best. Osama says yes. Asha says no. Faizan Raza, a big aquarium with proper care. Big aquarium, वो बहुत ज़्यादा हो जाएगा, फिर केयर करना पड़ेगा. Dr. Awesome says no. Wafa, okay. Grace, I already have it in my house, the one you're asking. Okay, last one. Yes or no? Yeah, last. Yes or no? Tell me very frankly, very fast. Yes or no? Kirtika says yes. हाँ जी, कोई नो बता दो. Metazillo, keep 2 goldfish, sir. हाँ जी, वो मैंने yes भी मान ले लिया. Okay, Priya says no, they should be in their natural habitat. Okay, Palak says yes. Aditya, okay. Karan, फाइटर रखो, सिंगल ही चल जाएगी. अच्छा, तेरे को रख लूँ मैं, तू घर आ जा, तेरे को रख लेता हूँ, सिंगल चल जाएगी. मोहम्मद इनाम says yes. Aditya says yes. Manisha says yes. Sushmita says yes. Ayo, there's so many yes. Okay, okay, we have Anjana, yes. Osama already said yes. Wafa Hussain says no. Okay, so I think we got the answer, but chalo, let me just talk to my instinct, and Shubhangi we have to talk about it. The other condition, guys, so I want you guys to, what do you call, yeah, 5 more minutes we'll study, we have to finish this topic. The other conditions of reverse differential cyanosis, TJ with pulmonary hypertension, you must remember, and differential cyanosis, PDA with a reversal of shunt, you must remember. The other examples of reverse differential cyanosis are dextro TGA with a VSD, severe coact, and supracardiac TAPVC. These are the other examples you must put in your notes for reverse differential cyanosis. TGA with pulmonary hypertension, DTGA with the VSD, D is dextro TGA with the VSD, severe coarctation of aorta with the supracardiac TAPVC, severe coarctation of aorta, then supracardiac TAPVC. These all are the examples of reverse differential cyanosis. Next question, please. Child born to a mother with SLE, a child born to a mother with systemic lupus erythematosus are likely to have one of the following anomalies. Karnataka exam had come. ASD, TOF, TGA, complete heart block. What do you think? Please put an answer in the comment section. Yeah, okay. Osama khud bola yes, and then ye line you decide first. Okay. Aditya says TAPVC long time ago here. This question, bro. A child born with a mother with SLE. The mother who are born with SLE can have which problem in the baby? ABCD quick answers, please. जो जहां रहने वाला है वहीं रहने दो, अच्छी बच्चा वहीं रहेगा. ओसामा, ये तुम्हारा आंसर है या शुभांगी का आंसर देख के तब तुम्हारा आंसर चेंज हुआ है? दोस्ती है ना, तो मुझे वैसा लग रहा है. यस, एग्जैक्टली. डॉक्टर आदित्य सिंह हैज द बेस्ट आंसर. कंप्लीट हार्ट ब्लॉक. Complete heart block is important in a case of what you call lupus erythematosus, or neonatal lupus, or even SLE. If the mother has SLE, it came in Karnataka exam, that complete heart block is very common. Remember, okay, complete heart block is the common congenital heart if the mother has a SLE. If the mother has a SLE. Great. And wait, one second. Okay, that next is TAPVC. I think we should finish it here. It's already 55 minutes are over. Okay. So before leaving, we have this motivating quote, and the motivating quote, amazing over here, is don't prove yourself. Don't prove yourself, improve yourself. So 55 minutes of class is over. We must end the topic over here because 45 minutes is our target. We should not study pediatrics for more than 45 minutes per day. Just come to my classes every day. That's it. Just 1 hour, just 45 minutes, nothing else I want. You will finish your whole book. You will finish, I think something amazing you will finish. That's what I have, the good vibes. So before leaving, we always have a motivating quote. Dr. Osama, do you have some amazing shari to share with us? And also before leaving, we have this beautiful quote which says, don't prove yourself, don't prove yourself, improve yourself. Don't prove yourself. It's a good quote. It's a very smart quote, actually. I like this quote. And I would like to say thanks to Dr. Savan. Dr. Savan is one of my juniors, and he has some amazing quote. He keeps sharing with me on WhatsApp. And if you guys have any amazing quote to share, my mobile number is 9999897081. If you have something motivating, something inspiring quotes or proverbs or any videos, do share. It will be good. I think good vibes run and it should spread. It's good way. So the quote is, don't prove yourself. Don't prove yourself, improve yourself. There is always, number one, there is always a room for improvement in our life. Number one. Number two, you should always be willing to improve. You should always be willing to say, yes, I think I should improve. Maybe it might be my fault. Let me improve myself. No. I did not do any mistake. Why should I say it's my fault? I have literally seen people on my face saying that, I have not done anything wrong. Why should I say sorry to you? Why should I say that I was wrong? I didn't do anything wrong. I agree, you did not do any wrong, but you should have, kind of a alter, kind of a adjustable nature, because in two arguments, if you love the other person and, if you don't argue, then you anyhow win. Okay, because why is the argument more important the relationship more important. You need to understand that the relationship is more important than the argument. Relationship is more important than the argument. Okay, even with my best friend also, whenever I fight or he says something bad, or anything which I don't, it happens so many times. Like whenever I don't agree with my best friend, then he like what I don't argue too much. I was like, friendship is important for me. Let's stop this topic, or I will say you win. You win. तुम जीत गए तुम खुश रहो, मुझे लड़ाई नहीं करनी. I don't want to fight. You win. Chill. Enjoy life. That's all. And then he or she starts laughing. I'm like, oh my god, why don't you fight? You should fight, Anand. Why don't you fight with me? I was like, hello, I have 1,000 more things to do than fighting. I don't want to fight. You win. You win. You enjoy. No problem. So that's what. So relationship is more important than the argument, and that's how it is. Thank you so much everyone for this wonderful participation. I hope, did you guys enjoyed the video today? Did you guys understood the class today? Today we did something crazy questions. These are very, very, very sophisticated questions. Differential cyanosis, reverse differential cyanosis, and Newton-Becker syndrome. This is something like crazy. This is a crazy stuff. If you have got this much, amazing. You are amazing. Okay. ओके या डॉक्टर फैजान रजा से सही पर खड़े होकर समंदर, क्या, हाँ जी, क्या, साहिल पर खड़े होकर समुंदर नापने वालों. Sahil, okay, doctor, we have Dr. Faizan Raza, who has a very beautiful quote to share with us, who says that साहिल पर खड़े होकर समंदर नापने वालों, साहिल पर खड़े होकर समंदर नापने वालों, कभी कभी मुखालिफ लहरों से लड़ो तो बात बने. ओहो हो, very heavy. What is this मुखालिफ? I don't know what is मुखालिफ. Tell me what is मुखालिफ. ओसामा, मुखालिफ का मतलब क्या होता है ब्रो? इन्होंने लिखा है फैजान रजा ने. सो साहिल पर खड़े होकर समुंदर नापने वालों, कभी मुखालिफ लहरों से लड़ो तो बात बने. Okay, I think I got the whole concept. Okay, if I just take out the mukhalif and mukhallaf, just लहरों is also nice. साहिल पर खड़े होकर समुंदर नापने वालों, कभी लहरों से लड़ो तो बात बने. कभी लहरों से लड़ो तो बात बने. हमें ये समझ में आ गया. I got the whole thing, bro. Very nice. We have to finish the class. Thank you so much everyone. And Osama has a quote. 1 second. बहुत खास थे कभी नजरों में किसी के, नजरों के से बदलने में Osama, very nice. Osama has a very nice quote. I want to share. Osama says, बहुत खास थे कभी नजरों में किसी के हम भी कभी. बहुत खास थे कभी नजरों में किसी के हम भी कभी, मगर नजरों के तकाजे बदलने में देर कहाँ लगती है. So yes, very good. I'll repeat again. बहुत खास थे कभी नजरों में किसी के हम भी कभी, मगर नजरों के तकाजे बदलने में देर कहाँ लगती है. So people change, everyone change, we change, you change, everyone change, I always tell my friends, today someone has ditched you. Today someone has ditched you, tomorrow you will ditch someone. This is life. I have seen people. Today someone has hurt you, tomorrow you will hurt someone. So it's like, today someone has ditched you, but tomorrow by mistake, unknowingly, knowingly, you will ditch someone. So, the moral of the story is that, like, be humble. We all have a past. Be humble. We all have a past. We are no one to judge the other person. Be humble. We all have a past. And we always say that in Hindi we say, na, किसी से दिल नहीं मिलता तो कोई दिल से नहीं मिलता. So ये जिंदगी का दस्तूर है. किसी से दिल नहीं मिलता तो कोई दिल से नहीं मिलता. So it's a very deep quote. I hope you guys one day will understand this point. So किसी से दिल नहीं मिलता तो कोई दिल से नहीं मिलता. So that's life, So enjoy it, chill, be happy. Thank you so much everyone for this wonderful participation. I had a very good time. I felt happy talking to you guys. Thank you. I hope you felt the same. Cardiology is coming to an end now. Enough of cardiology. We have done PhD in cardiology. So 1 or 2 more topics: TOF, truncus arteriosus coarcta, and 1 more case presentation. I have made notes, very nice notes I have made. We will discuss it. It's gonna be crazy. You will get goosebumps if you attend the cardiology classes. Thank you. Take care. See you tomorrow 8:30 p.m. and take care. Bye bye.